Hi guys, we're going to get close to being done. I think you have this chapter plus two more before we finish this unit. And then your next unit is pretty small, just a few chapters, so you're getting close. This chapter is the eye, ear disorders and diseases. So we'll just jump right in here. So let's talk a little bit about the anatomy and physiology of the eye. This is a sensory organ that's located in the orbit of the skull. It includes the sclera, the cornea, the iris, and the pupil. And it has different chambers. It also includes the lens, the retina, and there's some other, the choroid layer and the posterior cavity. You don't really need to know those things. I think that there may be something on your exam about some of the more common things that you see, like the lens and the retina, but you're not going to need to know about those other things. Maybe the sclera, the cornea, the iris, and the pupil, but I'll post a study guide so you guys know what areas to focus on. Then you have the ear. You have the external ear and the middle ear. The external ear and the middle ear are separated by a tympanic membrane. So the middle ear has the tympanic cavity, and it includes the different areas that you see there. You don't really need to know those. Just know that there's a separation there. The inner ear is the most sophisticated part of the ear, obviously, that wants to be protected. So it is responsible for your hearing, your equilibrium, and the cochlea is your organ of hearing. So different common signs and symptoms of eye disorders might include pain or burning in or around the eye, a visual acuity, or an impact of your ability to see either close up or far away, or blurry vision. Any disorder like seeing flashes of light. A lot of times I'll hear people say that they see like floaters like in their eyesight, eye redness. All of those things are not normal. There's different kinds of disorders of the ear. Anytime typically that you see that OTALGIA there, there's other ones that you're going to see in here that look like that. Those usually have to do with the ear, like oto. Those have to do with the ear a lot of times. Deafness, vertigo, tinnitus. Tinnitus is ringing of the ear, and make no mistake that that can be almost disabling for some people. It can be severe. Vertigo is dizziness. All right, there are different refractive errors of the eye. 1/3 of the population has some sort of refractive error of the eye. So people who grow up and don't ever wear glasses, that's pretty common, but it's also pretty common to wear glasses or contacts. And then you have nearsightedness and farsightedness. You can also have age-related problems with your eyes, and astigmatism is an irregularity of the surface of the cornea. I'm not for sure. It might be interesting to know how common an astigmatism is. I hear a lot about it. Conjunctivitis is an inflammation of the conjunctiva. This causes excessive tearing, itching, burning, and pain. You're going to want them to put warm compresses, take anti-inflammatories like ibuprofen, analgesics for pain, and an antibiotic ointment most of the time, because itis we know is inflammation, and they can prevent that with good hygiene. We talk a lot about not rubbing your eyes or putting your hands on your face. I know of a pharmacy one time that wouldn't hire people if during the interview they touched their face with their hand, because that's just how you transmit things. There you go. There's some conjunctivitis in somebody's eye. There's another one. That is likely going to need some antibiotics, because you see that crusty stuff there, yellow, that's not normal. Usually when you see that, they'll have like a red to that white part of their eye there, but this one doesn't. All right, blepharitis, you don't really need to know a lot about this, but this is you will see it though. It's an inflammation of the edge of the eyelid, the eyelash follicles, and the glands. It's caused by a bacterial infection or an allergic reaction. This is very uncomfortable, and people will come in and you'll, like, once you know what this is, you'll always know what it is. They're going to have red, swollen, encrusted eyelids, and they're going to get antibiotics or an allergy medicine to treat it. Keratitis is inflammation of the cornea caused by trauma or infection. It's usually one-sided. Unilateral is going to be just one side of the one eye, not the other. And they're going to be sensitive to light. That's what photophobia is. They're going to have pain and excessive tearing, but you're going to know it mainly because it's that just one-sided. They're going to get antibiotic ointment or drops and pain medicine and an eye patch. There you go. There's a picture. A stye. This is an inflammatory infection of the sebaceous gland of the eyelid. It's going to look like a pimple. I've seen this a lot. This is usually caused by staph, and they're going to treat it with warm compresses and give them a topical antibiotic. Sometimes I have never heard of them given systemic antibiotics. What that means is that they're taking a pill. I guess it can happen, but I've always seen topical antibiotics for this. Cataracts are clouding of the lens. This is caused by a change in metabolism and nutrition in the lens, but most commonly aging. You don't hardly ever see young people with cataracts. They're going to have decreased vision, and they're going to get lens replacement surgery. I just heard of a new cataract surgery where they don't have to go in. It's like they don't have to actually replace the lens. They can go in and just suck the cataract out. That's something that I haven't done much research on, but I just heard of that within the last 2 weeks. That would change a lot of the face of cataract surgeries. Glaucoma, this is excessive eye pressure. It's going to be slow progression, and a lot of times people won't even have symptoms until it's really bad. Permanent damage is going to occur before they get symptoms, and they're going to give them eye drops and surgery. So if you guys go to the eye doctor and they say that they're going to check the pressure in your eyes, and I'm squinting now as I'm doing this, but they put that little air thing up to your eye, and they put little puffs of air in your on your eye. They're checking the pressure of your eye to check for glaucoma, because this can cause people to go blind, and years ago did cause people to go blind. Nystagmus is a constant involuntary movement of the eyes that can affect one or both eyes. This is caused by brain tumors, different diseases, alcohol misuse, congenital defects, and they're going to treat it by treating whatever one of those causes is. And I think there's a video here, and I don't know if it'll let me play it on the video. Let's see. Hopefully you guys can see this. But this girl has nystagmus. And if you can't see it, you can click on the link and get to it. But that's what nystagmus looks like. She seems like a very sweet girl. All right, let me go back to, all right. Strabismus is just when the eyes fail to focus in the same direction simultaneously. This is due to a muscle weakness in one or both eyes. So they're going to do eye patching to try to correct it, eye exercises. They might do corrective lenses like eyeglasses, and sometimes they'll do surgery. I think years ago this used to be called lazy eye. Macular degeneration. This is a degeneration of the macular area of the retina. This is age-related, but this is hereditary in a lot of cases, and they're going to have a loss of their central vision. They can do laser surgery, but a lot of times these people will go blind. Diabetic retinopathy is the leading cause of blindness in the United States, and this is caused by diabetes. And they can do some laser things, but really they want to prevent this by controlling their blood sugar. And if you think about it, it's mostly because your eyes are very, very small vessels. And so when things get clogged up, like when your vessels when there's a lot of sugar floating around in there, and it's going to get clogged up, it's not going to get what the oxygen and the things that it needs, because it's so small, it's not going to get there. And so that's going to cause damage. Color blindness, this is the ability to see color, and it can be because with age, but it also can be inherited. And most people who are colorblind have the affects their ability to distinguish between red and green, and there is no cure for it. I don't know if you guys have seen those videos of the people who get glasses to impact their color blindness and then they can see, and it's very tearful how they, after all the years of not being able to see red and green, and think about how that impacts their ability to drive with the stoplights and such. Otitis media is an inflammation in the middle ear. This is commonly impacts infants and young children. There can be different types, but just know that mostly they're going to treat it with pain medication, decongestants to get some of that fluid off, and antibiotics. Sometimes, depending on how severe, they will use antibiotics that are just drops, like that go into the ear, and then other times they'll get systemic antibiotics where it's a pill or a liquid that they're going to take. Otitis externa is also known as swimmer's ear. This is an inflammation of the external ear canal caused by a bacterial or fungal infection. They're going to have extreme pain, fever, and it's going to be like itchy, drainy feeling. They can have hearing loss, clear or purulent drainage, which it just means that it's going to look like a yellowy green color. Treatment is to keep the ear clean and dry. They're going to give them pain and antibiotics like I talked about. Mastoiditis is an inflammation of the mastoid bone or process, and this is going to, this can result from a middle ear infection, and they're going to have ringing in the ears, they're going to have pain, hearing loss. And that's not permanent necessarily, but they're going to treat it with antibiotics, and they may go in there and remove part of that to see if that's helpful. Deafness affects more than 25 million people. This can be conductive and sensory. Conductive is an external or a middle ear disorder that decreases and stops the sound conduction. And this can be because of many things. It can be because of earwax that makes you not be able to hear. There can be a ruptured eardrum. It can be because somebody has something stuck there in their ear. There's lots of different causes. A sensory hearing loss would be more due to damage that's there that they can't necessarily fix. Impacted cerumen is just that yellow-brown earwax that you get, and for some people this is really odd because there are some people who produce more of this than other people, and I don't really know why that is, but there are some people who this really bothers and they can get an impacted ear very, very quickly, and then other people won't have one their entire life. But there can be excessive hair in there, a narrow canal, excessive dust, their skin may be dry, so it flakes off in there and causes some problems. And they're going to do an ear lavage, which just it's cleaning out that ear. I worked for a doctor one time early on in my career, and he was doing an ear lavage where he was, essentially they take like liquid and they shoot it into the ear to try to get that, and then they take a little loop tool to flip that wax out. And I was standing there holding the little bucket thing to catch the wax that was going to come out, and he put that little tool in there and he flicked it, and he didn't see it, and he said, "Where did that go?" And I was like, "On my shoe." Like it had come out and flicked so far that it had landed on my foot. It's pretty gross. Okay, so this is more of a progressive sensory deafness related to aging. This is something that usually occurs later in life, and it's deafness is all that it really boils down to, and people are going to use a hearing aid. But most of the time, this isn't going to begin till after the age of 50. But there can be early hearing loss depending on what people do for a living. So we had a gentleman coming over to our house the other day, and he was enclosing a room in our basement, and he had this big nail gun thing out, and he was shooting that, and it had this big air compressor, and it was hard for me to be in there, and he was right next to it. But he said that he has quite a bit of hearing loss. He's not 50 yet, but he has quite a bit of hearing loss because of it. So just keep that in mind, that it's not always because of aging. Motion sickness, this is experienced nausea when traveling, And it can also be when you're on like roller coasters and things like that. Symptoms would be nausea and vomiting. Diaphoresis would just be like a sweating, pale kind of feeling. Vertigo would be that dizzy feeling. You can give them anti-motion sickness medication. I don't think closing the eyes is very helpful, but rest. Corneal abrasion, this is more along the lines with trauma, and this can be caused when something is trapped between the eyelid and the cornea. Ill-fitting or worn contact lenses, accidentally poking your eye, welding can cause this. I saw one gentleman who had a little piece, a little shard of metal in his eye, and it was embedded in his eye. Oh, it looks so painful. So they're going to remove it. They're going to give him antibiotic ointment. They may also patch that eye to give it time to rest, pressure dressing, and they want to reduce the pain. Retinal detachment. I have never seen this, but this apparently often occurs with trauma, diabetes, and other retinopathies. These people will have blurred vision, flashes of light, floating spots. It's a painless disorder, but it does need attention and surgery. There's the detachment that you see due to the little hole. That should be, the little white line right there should be up just like it is there on the bottom. And obviously, when you're talking about refractions and the light coming through that area there and refracting off the back, that's going to mess that up. You can also have a ruptured tympanic membrane. I actually thought that I did this when I was in Mexico, and I ziplined into a body of water, and I dropped like 20 feet into the body of water, and the water shot up my nose and in my ear, and I had this horrible like sudden pain and pressure in my ear. I thought I had ruptured my tympanic membrane, but I had not. But it can be caused by many things like ear infections, or they say you can do it with Q-tips and things of that nature. They're going to have pain, partial loss of hearing, and a drainage. Purulent drainage just means that it's going to have that yellow or green tinge to it. Antibiotics, they're going to treat, and they're going to do a surgical patching. Meniere's disease is a chronic disease of the inner ear. This causes ringing in the ears, dizziness. People will get a progressive hearing loss, and they're going to have a feeling of fullness. This can also cause, excuse me, motion sickness due to that vertigo. So if you have somebody who has motion sickness already, and then you add that vertigo or that dizziness and the ringing in the ears, they will actually can have nausea and vomiting, and attacks can last a few hours to several days. So just, it's a very chronic disease, and it can be very, very significant for some people. They're going to give them medications to control their nausea, a low salt diet, diuretics, antihistamines, and they want them to quit smoking. They may do surgery. So effects of aging on the eye, they're going to have changes in the ability to focus, color perception, sensitivity to light, decreased visual acuity, meaning that they can't see as well, glaucoma and cataracts, and you don't need to know what that bottom one is there. They're going to have thinner and less flexible tympanic membranes, degenerative changes in the neurons and the bones in the middle ear and the cochlea. Essentially, they're not going to hear as well. All right, post if you have any questions.